Pirtobrutinib is a non-covalent BTK inhibitor, which in the original BRUIN study published in Lancet earlier this year, really showed tremendous potential for efficacy and safety. In terms of efficacy, it worked specifically in patients who were prior BTK exposed, and from a safety standpoint, didn't show the same toxicity profile we see with other BTK inhibitors. So we didn't see as much atrial fibrillation, neutropenia, or bleeding or bruising events. And so given that early phase data, which showed promise, even in a BTK pre-treated population, there's been development of a new study to basically compare this head-to-head to current covalent BTK inhibitors. So the BRUIN MCL Phase III clinical trial is going to take any patients with relapsed mantle cell that are BTK naive, and patients will be randomized to investigator's choice. So they can choose between the approved BTK inhibitors. They can give Zanubrutinib, Acalabrutinib, or Ibrutinib as a standard of care option. And then the other half of patients will be randomized to Pirtobrutinib. This is exactly the kind of study we want to see done. Rather than comparing Pirtobrutinib to historical controls where we know Pirtobrutinib would be better, this is really comparing it to the current standard of care. And so I think it's a very exciting trial to be a part of. And I'm glad that the sponsors of the company have designed it to really give us a signal as to how this compares to the current standard of care with the covalent BTK inhibitors.